Hello doctors. This is your online medical educator, and today we will do a quick review of the acute abdomen. Acute abdomen refers to new onset of severe abdominal pain and tenderness, which mostly requires surgical intervention. Inflammation, perforation, obstruction, and ischemic are one of the major causes of acute abdomen. Suppose a patient presents with periumbilical pain, which may or may not radiate towards the right lumbar quadrant with rebound tenderness. In that case, this must be the case of appendicitis, which presents as an acute abdomen. Similarly, if the female, fertile, fatty patient presents with acute abdomen in her 40s age, you can always think of cholecystitis. A perforation can occur in peptic ulcer disease, diverticulitis, or inflammatory bowel disease, which ultimately presents as acute abdomen. If an elderly male cigarette smoker presents with an acute abdomen, we can think of a ruptured abdominal aortic aneurysm. If a young female patient presents with positive beta-HCG with acute abdomen, then the case of an ectopic pregnancy should come to your mind. There can be a case of bowel obstruction, which can present with acute abdomen, in which patient may present with vomiting and constipation secondary to adhesions, hernia, or malignancy. The volvulus can cause obstruction in extremes of age, ultimately presenting with an acute abdomen. Ischemia is one of the causes of acute abdomen. It may be mesenteric ischemia, in which mainly the elderly will present with atrial fibrillation. It can be a strangulated hernia, which presents as a bulging abdominal mass, or a young female patient presenting with intermittent pelvic pain with ovarian torsion. As far as the management of acute abdomen is concerned, the first and foremost thing is to stabilize the patient and order diagnostic imaging in order to rule out the cause. Consider antibiotics to cover intra-abdominal pathogens. Consult with surgical subspecialties as appropriate for definitive therapy and, last but not least, pain management. I appreciate your time and interest. See you at the next review.